Buenos días a todas y todos,
Good
bienvenidas
morning,
y
everyone.
bienvenidos. Mi nombre es Leslie
Welcome.
Berjar, soy
My
oficial
name is
técnico en
Leslie
la
Bejar.
nutrición y
I'm the
sistemas
technical
alimentarios
officer
del
for
Departamento de
Nutrition and
Enfermedades No
Food
Transmisibles
Systems
y
for
Salud
the
Mental de la
Non-Communicable Disease
Organización
and Mental
Panamericana
Health
de Salud.
Department from the Pan American
Y
Health
en nombre de
Organization.
la OPS les
And on
damos la más
behalf
cordial
of
bienvenida
PAHO,
a
I
este
warmly
tercer
welcome you to
webinar
this third
técnico
technical
titulado
webinar
Recomendaciones de
entitled
Alimentación y de Actividad
Nutrition
Física para
and
Mejor
Physical Activity
Atención de las
Recommendations
Enfermedades
for
No
Better
Transmisibles.
Attention of
Este webinario
Non-Communicable
técnico
Diseases.
forma
This
parte
technical
del
webinar is a
itinerario
part of
formativo
the
de la
training
iniciativa Mejor
schedule from the
Atención para
initiative
las Enfermedades
Better
No
Attention for
Transmisibles,
Non-Communicable
acelerando
Diseases,
acciones en
accelerating
atención
actions
primaria
in
de salud.
primary care.
Y bueno, darles unas
And I
pequeñas
would like to
recomendaciones y
give you some
recordatorios. Cada uno
tips
de
and
estos
reminders.
webinarios tiene una
Each of these
duración de
webinars
90
has a
minutos.
duration of 90 minutes.
Recordarles que está
I would
disponible la
remind you
traducción
that we have
simultánea en
simultaneous
español,
translation
inglés y
available into
portugués.
Spanish,
Y de la
English,
misma
and
manera
Portuguese,
estarán disponibles en estos tres
and
idiomas en
also
la aula web.
the web
Los seminarios
classroom will be
se van a
available in
ir
these three
desarrollando
languages.
durante los meses
The
de
seminars will
septiembre a
be carried
diciembre de
out
este
during
año.
September to December of this
Este
year.
seminario, como les compartía, es el
The
número
seminar,
3
as I
de un
was saying, is
total
the
de
third
5 seminarios
of a
que
total of 5
finalizarán el 10 de
that will
diciembre.
be ending on
Sin
December
embargo,
10.
podrán visualizar las grabaciones
However,
de los
you will be able
webinarios
to
y
review
realizar las
webinar
evaluaciones a
recordings
través de los
and to
cuestionarios hasta el mes
have
de febrero de
assessments and
2026.
questionnaires until
Esto de
February of
forma
2026.
asincrónica. Para
So
la
this will be
certificación,
asynchronous.
los
For
participantes y las
certification,
participantes que visualicen
participants
los 5
who
webinarios
review
o
all
los 5
5
seminarios
webinars
y que hagan las
and
lecturas de las
who
fuentes
follow
bibliográficas que se comparten,
the reading
así como
materials
los
from the
cuestionarios de
book sources
evaluación,
that are shared, as well
recibirán
as
un
assessment
certificado de
questionnaires,
aprobación del
will
plan de
receive an
seminarios en el
approval
campus virtual de salud
certificate
pública de la
from
OPS
the
con una duración de
virtual
10
classroom
horas.
PAHO department with
Ahora
a
bien,
total
si pueden
duration of 10
participar de
hours.
forma
Now, if you
sincrónica,
are
en el
able
aula
to
virtual
participate
están
synchronously,
disponibles las
the
fechas y
virtual
los
classroom
enlaces de
contains
acceso
the
a cada
dates
uno de
and
los
the access
webinarios
links to each of the
que
webinars,
requieren previa inscripción
which
para poder
require
participar. Durante el
subscription
transcurso de
or
este
enrollment
webinar vamos a estar
beforehand to
compartiendo
participate.
en el chat
During this
los
webinar, we will be
enlaces y los
sharing via
detalles
the
y
chat all
respondiendo a todas
links and
sus
details
dudas
and answering
técnicas de
all your
esta
technical
serie de
questions
webinarios.
for this
Y
set of
bueno, sin
webinars.
más, de nuevo, darles la
And now,
bienvenida a este
without
tercer
further
webinario de
ado, I would like to
recomendaciones de
welcome you to
alimentación y
this third
actividad física para
webinar
mejor
on
atención
physical activity and
de las
nutrition
enfermedades no
guidelines for better
transmisibles.
attention of
Y
non-communicable
recordarles que
diseases.
tenemos el día de hoy
And I would
tres
like to remind
objetivos
you that we
primordiales.
have 3
Número
main
uno,
goals today.
presentar las
First,
recomendaciones de la
to present
OPS y la
recommendations
OMS
from
sobre
PAHO
alimentación
WHO
saludable
on
para
healthy
apoyar en el
nutrition
abordaje de las
to
enfermedades no
support
transmisibles en la
tackling
atención
non-communicable disease
primaria de
in
salud,
primary
así
healthcare
como
attention,
las recomendaciones de
as
la
well
OPS
as
y la
recommendations
OMS
from
sobre actividad
WHO
física.
PAHO on physical
Y bien,
activity.
por último y no menos
And lastly,
importante, visibilizar
no, though
las
not less
experiencias
important,
nacionales
to
concretas
shed
que
light
ilustran la
on
aplicación de
concrete
estas
national
recomendaciones
experiences
en
that
los servicios de
illustrate the
atención
application
primaria de
of
la salud.
this advice in
Le paso la
primary
palabra a
healthcare
mi
attention.
colega
I will
Vanessa
now
García
hand the floor
Larsen,
to my
jefa de la
colleague
unidad
Vanessa
de
Garcia
factores de
Larsen,
riesgo y
head of
nutrición,
the
para
Risk
que nos
Factors
dé
in
unas
Nutrition
palabras de
department,
bienvenida
so
y
that she
apertura.
can give us some
Over to you, Vanessa.
welcoming words.
Gracias,
Over, Vanessa.
Leslie. Buenos días,
Thank you,
buenos
Leslie,
días.
and good morning.
And thank you all for joining us today. On behalf of the Pan American Health Organization, it is my pleasure to welcome you all to the third technical webinar of the Better Care for NCDs initiative. Today, we address an issue at the very heart of non-communicable disease prevention and control: healthy diets and physical activity at the primary health care level. Non-communicable diseases account for nearly 80% of deaths in our region. This is not only a health challenge, but also a social and economic one, as families, communities, and health systems carry the weight of premature illness and disability. Too often, the environments in which people live and work promote unhealthy options. Easy and affordable access to ultra-processed foods, for example, and beverages excessive in sugar or salt, as well as behaviors and built environments that limit physical activity. Scientific evidence suggests that over 80% of children and adolescents in the region of the Americas do not meet the WHO recommended levels of physical activity. And as of 2022, over a third of adults are insufficiently active, with the prevalence of physical inactivity being more common among women. On the other hand, the continued increase in per capita sales of ultra-processed products observed during the first decade of the millennium in 12 Latin American countries has demonstrated how greatly they contribute to displacing traditional diets based on wholesome foods and meals. In such environments, it is unfair to expect that individuals alone shoulder the responsibility for adopting healthy behaviors. Governments and health systems must create conditions where making a healthy choice is the easiest option. Our region is making progress with laws and regulations that reduce the demand for and offer of ultra-processed products, including front-of-package warning labels and marketing regulations. However, we do need to expand efforts to generate regulatory frameworks that ensure access to nutritious foods, safe spaces for physical activity, and also supportive policies that empower communities to thrive. This includes, for example, infrastructure for accessible, safe, and enjoyable places for recreation and active transportation. And this is where primary health care plays a decisive role. It is the first point of contact for most people and an ideal platform to provide not only treatment, but also clear, practical advice on healthy diet and physical activity. Both PAHO and WHO have developed recommendations that are evidence-based and broadly applicable, including for people living with NCDs. Today's session has 3 objectives: to present these recommendations on diet and physical activity, and most importantly, to learn from the real-world experiences we are going to hear from Brazil and Colombia, and translating them into action at the primary care level. But this webinar is not just about sharing knowledge. It's also part of a broader effort to strengthen capacity and to promote equity across health systems. The Better Care for NCDs initiative is designed to support primary care health teams so that together we can move forward towards systemic change. I encourage you to use today's discussion as an opportunity to reflect on how we can integrate these recommendations into practice, but also advocating for healthier environments that truly support the communities that we serve. Ultimately, Better Care for NCDs is not only about clinical guidance, but also about ensuring that people's surroundings make health the natural and achievable choice. So thank you all very much again for being here today, and I wish you a very productive and inspiring session. Thank you.
Thank you very much, Vanessa. And just a quick reminder, we have simultaneous interpretation. You can click on the icon of the globe at the bottom of the screen, and you can select the language that you prefer. So, ahora vamos a continuar con la
Now we will
participación
carry on
de
with
Fabio
participation
da Silva
from
Gómez,
Fabio
asesor en
da Silva
nutrición y
Gomez,
actividad física,
advisor
explicará
in
sobre
nutrition and
las
physical activity,
recomendaciones de
that
la
will present us
OPS y
on
OMS
WHO
sobre
PAHO
alimentación saludable como
recommendations on
parte de la
healthy nutrition as
iniciativa
part
de
of
mejor
the
atención en la
initiative
enfermedad non
on better
Adelante,
care
Fabio.
for non-communicable disease.
Muchas
Come in,
gracias,
Fabio.
Leslie.
Thank
Buenos
you so much,
días
Leslie, and
a
good
todas
morning,
y todos. Un
everyone.
gusto poder
It is a pleasure
participar en esta
to
ocasión para compartir un
participate on
poco
this occasion to share
de las
a bit
recomendaciones de la
on
OPS y la
the
OMS que
WHO
pudieran
PAHO
apoyar
recommendations
la
that
mejora de la
can
atención
support improving
en las nutramexides.
attention for non-communicable
Y es
diseases.
importante
And it is
empezar
important to
tratando de
begin
dónde salen esas recomendaciones, la importancia de
by
cómo
stating
se
where
han
this
construido,
recommendation
si se
comes
tiene
from,
más
the importance on
interés,
how
puede
this
usar
is built,
este
and
código
it is of
QR
your interest. You may use this
para
QR code
bajar y leer un poco
to download and read
este manual
this manual,
de desarrollo de las directrices y recomendaciones de la
which
OMS en las cuales
develop
nosotros nos basamos.
guidelines
Pero en
from
resumen es un
WHO
proceso
that we are
bastante
based on. But in
largo que
summary, this is a
involucra todo un
pretty long text that entails all planning and structuring teams and structuring critical questions that will be assessed to define interventions and recommendations that may be effective in developing the guide, which involves the use of systematic reviews and an assessment on the quality of evidence to be able to arrive at these numbers and recommendations and messages that are established. So every time that we discuss recommendations, we are talking not about something that seemed as a good idea to us only, but something that has been very robustly analyzed in order to deliver countries with better options for the population. And regarding nutrition and health, we have many guidelines. And in nutrition, often this happens that instead of having a single recommendation, we have many elements in diet that we have to address. But we will see that it is possible to summarize in many ways on what are the most general guidance that we can provide that can still be effective. But I will go through each of them to later think how we can facilitate delivering this information. One of the recommendations that is very important for the population that coexists with non-communicable diseases is the consumption of potassium, and that is established by WHO, PAHO, where the minimum recommended dose is 3,150 milligrams in the case of children. If you work with boys and girls who already live with non-communicable diseases, unfortunately, it is not something that we would like to see, but I understand that many of you may be dealing with this situation. This amount is a bit minimum, somewhat minor, obviously thinking about the needs of children. So we need to adjust regarding the energy needs of children, this value. So here we're dealing with a value that is applicable to adults, but they are thinking about how to translate that for the population. So it is important to highlight that the recommendations that pertain to foods that are under carbohydrates guidelines, but which are applied generically to foods, reflects particularly foods, for instance, fruits and vegetables, that is recommended for the people with 10 years or more. So even children with 10 years up to 18 years, also applicable this recommendations of at least 400 grams of fruits and vegetables. Why is this important? Because if one fulfills this recommendation, automatically one will be fulfilling, very probably will be fulfilling the recommendations of minimum potassium that we mentioned before. So perhaps this is a more simple message, and even so, the amounts in grams would have to be translated into foods, but that also you can search different ways to reflect into amount of foods. We know that fruits, for example, will always be a unit of fruit will be weighing around 100 or a bit less than 100 grams, depending on the fruit and so on. If it is very small, more or less the volume that a fruit takes up whole of a medium size, such as a banana or an apple, an orange, a mango, for example. And obviously, those vegetables that we can consider as, for example, a carrot or any other kind of vegetable that may be considered, that will also be added. It is not something that, in spite of a large number of 400, is not as difficult to reach. And the other point that I believe is very important is on the minimum amount of fiber. But here it is important to highlight that this is fiber
No es
coming from
suficiente que
foods.
uno va a
It is
tomar
not
los
enough
suplementos de fibra, eso,
taking
la
fiber
directriz es muy
supplements.
clara,
The
no va a
guideline is very
funcionar
clear that it
para
will not
ayudar, por
work
ejemplo,
to
a
help, for
mejorar el
example, to
perfil
improve
lipídico de las
the
personas
fat
o
profile
prevenir
of
otras
people or to
formas y
prevent
otras expresiones de las
other
enfermedades o riesgos de
expressions
enfermedades no
of
transmisibles. Y una manera
non-communicable
muy importante,
diseases.
casi quizá más
And
sencilla de
another more
asegurar
important
esos
and perhaps
25
simpler way
gramos,
to ensure those
25
25 grams
gramos sería
would
asegurar que las
be
personas
to
todos los
ensure
días puedan
that
comer algo
people every
vegetable,
day can
sea
eat
frijoles o
vegetables, so
garbanzos,
beans
lentejas, sí,
or
todos los
chickpeas
días,
or
una de las
lentils
comidas tengan
every
esos
day.
alimentos, nos estaremos
If
mucho más
some foods
cerca de
include those foods, we
alcanzarlos
would be much closer
que si
to
no
achieve it
lo tenemos,
than
¿no? Eso
if we do
nos
not
permite
have
facilitar
them.
un poco el
That
mensaje.
allows
Ahora,
to
pensando
ease
los
the
alimentos o
message
los
somewhat. Now,
elementos de la
thinking
alimentación que
about
son, vamos a
elements of
decir,
nutrition, which
hablemos hasta
are,
ahora
let's
los
say, we have
positivos, lo que
discussed to this
debemos
point,
consumir,
those that are
las
positive,
frutas,
that
vegetales,
which we should be
legumbres,
consuming, fruits,
es fundamental.
vegetables,
Ahora los que tenemos que
and it is
restringir,
fundamental,
también
but
tenemos
we also need to
metas
restrict
específicas.
as
Yo
we
sé
also
que
have
debemos
specific
como
goals.
adultos no consumir
So,
más
as
de
adults, we
2000
should not be
miligramos de
consuming more
sodio, sea que
than
son
2,000 milligrams
de
of
sal,
sodium,
y
which
para
means
niños
less
otra
than
vez
5
eso
grams
tiene
of
que ser
salt. And for children,
ajustado.
again, that must be
Niños
adjusted.
que
In
tenemos que estar
children, we
controlando,
need to be controlling,
también que trabajan ustedes, por ejemplo, con niños,
since
también
you also
deberían
work with children,
ajustar esta
you
cantidad
would
para
also
que sea
have to adjust
superior a
this
su
amount so that it
necesidad
is
energética
not higher than their
equivalente
energy needs and the
de
equivalent
sodio.
in
Y vamos
sodium.
a ver un poco cómo
And we
podemos
will look
simplificar
at
eso,
how we can
pero una de las
simplify that,
maneras
but one of the
de
ways
hacerlo
to do it
es ya
is
favorecer que las personas puedan
favoring for
cocinar su
people
propio
to be
alimento,
able to cook
porque
their
obviamente
own
sí, uno
food,
podría
because
decir, ah, es que tienen
obviously
que
one could
llevar
say,
las
oh,
etiquetas
you
de los
need to
productos
see
que
the food
vienen, eso es
labels,
una manera de
but that
hacerlo,
is one
pero
way
igual
to
no
do
tiene el
it.
control de cuánto
But
sodio
still, you
puede
have no
tener. Lo que
control
puede
on how
hacer
much
es mirar o
sodium
no mirar
another
y
can
quedar ahí
have.
muchas
You
veces sin
might see it
poder
or not,
decidirlo.
and
Entonces, lo
or remain
mejor
there
es
without
tener
being
el
able to
poder en
decide.
sus
So the
manos
best
de
is to have
decidir
the
cuánto
power in
va a
your hands
entrar
to
en su
decide how
alimentación
much will get
y
into
tener esta
your
cantidad
nutrition and to
establecida
have
para lo
this
que se va
amount
a preparar
established
este día, por ejemplo, ¿no?
or what's going to be prepared
De
for
la
the
misma
day, for
manera,
example.
tenemos
In the
la
same manner,
recomendación de
we
azúcares.
have
Esto ya va
advice on sugar.
presentado en
This
la
is
proporción de
already
energía
presented
que
with regards to
provienen de
the
los
share
azúcares
of energy that
libres.
comes from
Y en
free
este caso
sugars.
ya se
And in this
ajusta a toda la
case,
población.
it
Esto
is
significa
adjusted
que
to the
no
whole of the
importa si estoy
population, which
hablando
means that it
para un
doesn't matter
niño,
if
si
we're
estoy hablando para
discussing
un
children
adulto,
or adults.
estoy tratando del
I am,
percentual de azúcares
this is
que
about the
de toda la
percentage of
alimentación
sugar that
de
out of the
esta
whole
persona
diet for
puede
this
o
individual
debería venir de azúcares libres. Y
should not
azúcares
come
libres
from free
acá
sugars.
esto contablerizando
About free
tanto el
sugars, here
azúcar
we're
que
accounting
se
for
puede
both
echar a
sugars
una
that can be
preparación
poured
en
into a
casa, tanto el
preparation at
azúcar que
home,
se encuentra en,
as
por
well as the
ejemplo,
sugar that
bebidas
is in,
azucaradas
for
o
instance,
productos
sugared
hiperprocesados,
beverages or ultra
bien
processed
como
products,
los azúcares que
as
están
well as
presentes
those sugars that are
naturalmente
present
en un
naturally
jugo que
in a
también se deben
juice
restringir.
that should
Para
also be
las
restricted.
grasas
Now,
saturadas
for
tenemos
saturated
la
fats,
misma
we
proporción
have
del
the same
10%,
share
tenemos que
of
restringir
10%,
al menos del
where we need
10%
to
de lo
restrict
que
to less than
comemos en la
10% in what we
fórmula de
eat
grasas saturadas y la
in the form of
cantidad de
saturated
grasas
fats, and the
trans
amount
debe
of
ser
trans
aún
fats
mejor, no
must be
superar 1%, o sea,
even
menor que un
less,
1%
not
de la
to go
alimentación
over
puede
less than
contener
1% of the of
grasas
nutrition
trans.
may
Y
contain
finalmente el
trans
total de
fats.
grasas
And
total,
finally, the
el total de
total
grasas también debe ser
of
restringido
fats
a
must
no
also
más
be
o a menos
restricted
de treinta por
to
ciento
less than
porque también
30%
está
because
relacionado
it is
a
also related
o
to
puede
or
incrementar
can
el riesgo
increase the
de
risk
obesidad, entre
of
otros
obesity,
factores
among
que
other
nos
factors
preocupan
that
en esta
concern
etapa.
us in this stage.
Finalmente, una otra recomendación más
Finally,
reciente se
another more
refiere no
recent
a un
recommendation
nutriente, pero a un
refers not to
ingrediente
a
que
nutrient
muchas
but to
veces
an
se puede
ingredient
echar a
that
las
often can be
preparaciones
poured
culinarias o que se puede
into
consumir entre los productos
kitchen preparations
ultraprocesados
and can be consumed
y
among
la
the
recomendación es
ultra-processed
evitar,
products, and
que
the
son
recommendation is to
los
avoid them.
edulcorantes
And
o
these
los
are
edulcorantes
sweeteners or non-sugar sweeteners.
también tienen
Sweeteners
efectos
also have
negativos
negative
para la
effects
salud y la
to
revisión
health,
sistemática
and
que se
systematic review
realizó desde la
that
OMS
has been performed
identificó que en
from
el largo
WHO
plazo
identified that in the
pueden
long run, they
incrementar
can
riesgo de
increase
incidencia de
the risk
obesidad,
of obesity
riesgo de diabetes tipo 2, todas
and
las
type
causas
2
de mortalidad,
diabetes
enfermedades
with mortality
cardiovasculares,
causes and
cáncer,
cardiovascular disease,
riesgo de
cancer, risk of
nacimiento pretermo, entonces también
preterm
para
births,
el embarazo. Entonces, un poco la
as it
recomendación
affects
sale como
pregnancy. So the
y muy clara de que se
recommendation is
debe
very
desalentar
clear
el consumo
that
también de edulcorantes no azúcar. Después podemos
Non-sugar
comentar
sweetener
algunos
use should be
detalles si se
discouraged.
quiere.
We can later
Ahora, ¿cómo
comment
podemos resumir
this
de
in
una
further
manera
detail if you
más
want. Now, how
sencilla a
can we
las
summarize
personas estas
more
recomendaciones de
for
restricción de
people
sodio,
these
de
recommendations for
azúcar, de
restricting
grasas
sodium,
saturadas,
sugar,
de grasas
saturated
totales?
fats, and
Entonces,
total
la
fats?
primera que yo
So the
mencioné
first one I
anteriormente, si
mentioned
nosotros
before
volvemos
is if we go
a
back
cocinar y preparar
to
lo que
cooking and
estamos consumiendo,
preparing what we are
volvemos a tener
consuming,
control sobre los
then we
nutrientes,
have
las
control
cantidades de
on
lo
what
que
we are
comemos.
eating again and the
Entonces, eso es
amounts that we are
importante,
eating. So that
que
is
es un
important.
factor que nos da
This is a
más
factor
poder
that gives
sobre
us more
nuestra
power
alimentación y por
on
lo
our
tanto sobre nuestra
nutrition
salud.
and therefore on our
El
health.
otro elemento que es
And the
fundamental y
other
que
element
ya
that is
está muy
fundamental and which is
claramente
already very
establecido
clearly
es de
established
evitar los productos
is to
ultraprocesados. Vamos
avoid
a escuchar
ultra
un poco más en
processed
detalle la
foods.
experiencia de
We
Brasil,
will
cómo
listen
se puede
about the
detallar
Brazilian
mejor en
experience in
esto
further detail and how it
en la
can be more
consejería para
detailed
las personas y en otras
in
acciones que
counseling for
pueden
people
tener a
and
nivel de
also other
atención primaria.
actions that
Pero
can
básicamente
happen at the
el
primary
evitar
level. But
el
basically,
consumo de
avoiding
ultraprocesados nos va
consuming
a
ultra
ayudar
processed
a alcanzar las
products will help
recomendaciones de
to
la OMS,
achieve
la OPS, no
WHO
solo con
PAHO's
relación a los
recommendations, not only
nutrientes, pero
regarding
también con
nutrients,
relación
but
a los
also
macronutrientes, pero también a evitar otros
in
aditivos y otros
avoiding other
componentes en un
additives and
patrón
components
alimentario, vamos a
in
decirlo en
the food
general, que
pattern in
está
general
asociado con un
that is
gran número de
related
enfermedades que
to a
queremos
major number
prevenir
of
y
diseases that
o
we want to
queremos
prevent
controlar,
and
como
or
es el caso
control, such as the
de lo
case
que tratamos en
of
esta
what we are
presentación.
dealing
Entonces,
with in this
quizá un ejemplo de
presentation.
cómo se
So
puede
perhaps an example on how
simplificar y
it
ahí
can be
después vamos a escuchar
simplified,
más
and later we will hear more
de
from
Patricia de la experiencia de Brasil,
Patricia
cómo
and the
podemos hacer
Brazilian
llegar
experience and how we can
estas recomendaciones para
reach
que las personas
or
puedan
achieve
evitar
these
más
recommendations so that people
ultraprocesados
can
y
avoid more ultra
volver
processed foods
a los
and
alimentos
get back to
cocinados y preparados
cooked
con los
and
cuales
prepared
tenemos
meals
más control
with which we have
sobre
more
ellos.
control
Muchísimas gracias.
on that. Thank you very much.
Muchas gracias, Fabio.
Thank you so
Recuerden que
much,
tenemos
Fabio.
una cajita de
Remember, we
Q&A
have
donde pueden
a
poner sus
Q&A
preguntas y
section
esperemos
where you can
tengamos a
submit your
final de las
questions.
presentaciones tiempo para una
Hopefully, we
discusión,
have some
pero
time
si
for
no, de
discussion
cualquier
after the
manera
presentations,
revisamos
but
anotando y
anyhow,
podemos
we
estarlas
would be noting
contestando en el
them down
transcurso
and
de
we
este webinar.
are able to
Ahora
answer
bien,
them
vamos
during the
a
course of this
pasar
webinar.
con Patricia
Now we
Jaime.
will
Ella
move on
es
to
directora del
Patricia
Centro de
Jaime, who is
Investigación
director
Epidemiológica en
of the
Nutrición y Salud,
Research Hub
NUPENS,
on
de la
Nutrition
Universidad de Sao
and
Paulo.
Health,
Nos
NUPENS
va a hablar
from
sobre la
Sao
experiencia
Paulo
de
University.
Brasil
She
en
will
la
tell us about the
orientación y
experience in
promoción
Brazil
de la
on
alimentación
guidance and
saludable en la
promotion of
atención
healthy
primaria en la
nutrition and primary health care.
Bom dia, buenos días, good morning. Les gracias por la invitación. Yo voy a hablar en
Thank you
portugués.
for the invitation. I will speak in
Yo
Portuguese,
necesito que alguna persona
and I
ponga la
need
presentación.
somebody
Yo tuve un
to share the
problema en
presentation.
conexión
I had a problem in
yo
joining, and
estoy hablando por el mobile phone.
I am speaking through my mobile phone.
Obrigada pela
Thank you
oportunidade de compartilhar
for
a
the
experiência
opportunity
brasileira
of sharing our
a implementação
experience
da
in
Guia Alimentar da
Brazil
População Brasileira no
in
Brasil, na atenção
implementing the
primária e
dietary
saúde
and
do SUS.
physical activity
Pode
recommendations
passar a
for the
próxima,
best
por
care
favor?
in Brazil.
Então, eu
Next
sou
slide, please.
nutricionista e coordenadora científica do
I'm a
NUPENS, que é o
nutritionist
núcleo
and
de
I coordinate
pesquisa
the
que
NUPENS, which is the
desenvolveu a
Center
classificação
for
nova de
Research,
alimentos
which developed
e
the
ganhou na
new
literatura
food
científica nacional e
classification
internacional
system.
o termo
And
alimentos
we also
ultraprocessados, né?
developed
Então, a classificação nova,
the
ela se constitui como
expression
uma
ultra
inflexão
processed
na forma de
foods
estudar a
nationally,
relação entre
domestically, and
alimentação e processação
internationally.
de doença,
Now,
mas isso também pode
the
ser aplicado
relationship
na
between
produção de
food
orientações
and health
alimentares para a
is
população.
also
E
true
foi
for
isso que
designing
desenvolvemos numa parceria
dietary
com o Ministério da
guidelines
Saúde e a
for
Organização
the
Pan-Americana da
populace at
Saúde, o
large.
Escritório
And
Brasil,
so with
desenvolvendo um guia alimentar
PAHO,
para a
the
população
Brazilian
brasileira, nossa
office of
segunda edição,
PAHO would develop a
publicado em
series of
2014, que foi o
guidelines
primeiro guia na América
for
Latina
diet for
a
the
introduzir o conceito de
Brazilian
alimentos
population. And
ultraprocessados e
this was
produzir
the
recomendações
first
alimentares utilizando a
document that
classificação nova. Hoje,
used
na
the
América
concept
Latina,
of
nós já
ultra
somos 6
processed
países
foods.
que incorporaram essa
Today in Latin
classificação
America,
e
6
compreendendo
countries
guias
have
alimentares como instrumentos e
adhered
tecnologias em
to this
saúde, nós também
classification.
apoiamos o Ministério da
And
Saúde
we
no
also
desenvolvimento de uma
supported the
nova
Brazilian
tecnologia, que são
Ministry
os
of Health
protocolos
in
de
developing
uso
a
do
new
guia por
technology that
profissionais da
have to
atenção
do with
primária e
protocols for
saúde
using
do
the
SUS.
dietary
Próximo,
guidelines
por
for
favor.
PHC professionals. Next slide, please.
Então, esse é o objetivo principal da minha
So,
fala,
the
é
main
compartilhar
goal for my
experiências de
presentation
desenvolvimento
today
dessas
will be
tecnologias de
sharing our
implementação do guia
experience in
alimentar para a
developing
atenção primária em saúde e
the
também
dietary
todo o
guidelines for the
processo de
Brazilian
implementação dessas
population
novas
and its protocols
tecnologias
for use in primary health care.
orientados
A
pela Política
successful
Nacional de
Brazilian
Inovação Tecnológica em
experience
Saúde
in the
brasileira,
SUS or SUS, the
direcionando
Unified
uma
Healthcare
formação,
System
uma
of
capacitação
Brazil,
profissional para a implementação
directed
dessas
towards
tecnologias.
creating
O próximo.
professional training for implementing such technologies.
Então, é importante
It's
contextualizar, né? O Brasil
important
tem um
to
Sistema
give you
Nacional de
some
Saúde
background.
que está fazendo
Brazil has
35
a
anos.
unified
Ele é um
healthcare
sistema
system
público,
which is
gratuito,
celebrating its
onde se
30,
reconhece o direito
35th
universal à
university.
saúde
It
e
is a
alimentação adequada e
public,
saudável.
free of
Ele é um sistema de
charge
saúde
system that
descentralizado,
recognizes the
que
universal
desenvolve ações
right to comprehensive
compartilhadas
health
em termos
care.
de
It is a
responsabilidade do governo
decentralized
federal, do governo
system
estadual
and
e
relies
dos
on social
5.572
participation that
municípios
includes
brasileiros,
municipal,
e ele envolve
over
a
5,000
participação social
municipalities in
no
Brazil,
desenvolvimento
states,
das
and the
ações.
federal
Também é importante dizer o nível
government.
da
It also
complexidade
involves
de fazer
social
a gestão de um sistema
participation,
de
and in
saúde
terms
em
of
um
the
país que tem dimensão
complexity level in a
continental,
country
talvez o
that's
único país no
as
mundo
big as a
que tenha
continent, maybe
proposto e
the
assumido o
only
compromisso da
country in
direito à
the
saúde
world
gratuito,
who
universal,
has
para um
taken
país que tem uma
on
população de
a
mais de 200
commitment
mil
for
habitantes,
public free of
uma grande
charge healthcare for a
heterogeneidade regional,
population
cultural,
of
econômica e social.
above
É importante também
213
mencionar que o sistema de
million
saúde brasileiro
inhabitants.
ele
It's also
está
important to state that the
organizado
Brazilian healthcare
prioritariamente
system is
por meio da
organized
atenção primária em saúde,
prioritarily
utilizando a
through
estratégia de saúde da
APS
família como nosso modelo referencial,
or the family health
de organização da
strategy,
atenção primária, e
which
contando
is
com a
how
equipe mínima
our
composta por
primary
médicos,
healthcare
enfermeiros,
attention is
agentes
designed,
comunitários de
plus
saúde,
a
mas também com equipes
multi-professional team
multiprofissionais de saúde
strategy,
que vão complementar o
which
cuidado integral e
will
continuado, agregando
complement
saberes
the
como, por exemplo, do campo da
integrated and
alimentação, da
continued
nutrição e
healthcare
da física no cuidado
provision
dos
for
usuários na atenção primária em
citizens
saúde. Próximo, por
and
favor.
supporting primary healthcare in all
Então,
its main
nós sabemos o
dimensions.
peso que a alimentação inadequada tem na
We
carga
know
global
the
de
importance
doenças
of
e os guias alimentares,
inadequate
eles são
nutrition in the
ferramentas
global burden of
centrais para
disease.
enfrentar a
Dietary
tripla carga da
guidelines are
malnutrição e
essential
tanto
too
a
for
OMS
addressing
como
the
a FAO
triple burden of
recomenda a implementação
malnutrition.
de guias
The
alimentares como
WHO and the
estratégias
FAO both
de
recommend
enfrentamento das doenças
implementation
crônicas não
strategies
transmissíveis.
for the
E a educação
dietary
primária em saúde, ela
guidelines,
é
and
um
primary
âmbito
health
prioritário
care
para o desenvolvimento de
is a
ações de
priority
implementação de
area
guias alimentares.
for
O
these
próximo.
actions. Next slide,
Então,
please.
mas há um grande desafio nesse sentido, né? A promoção da alimentação adequada e saudável e a atenção nutricional, elas não são priorizadas na hora da organização do cuidado em saúde. Muitas vezes elas são secundarizadas em relação a outros cuidados em saúde, mais focados nos cuidados biomédicos e farmacológicos, né? Então, muito frequentemente, os usuários da atenção primária recebem orientações alimentares adequadas, baseadas em evidência científica e integradas ao cuidado em saúde. As principais barreiras que a literatura identifica é a falta de tempo para o direcionamento dessas ações, a baixa capacitação e confiança dos profissionais para falar sobre alimentação, seguindo os guias alimentares. Próximo, por favor. Então, nós temos uma grande oportunidade, que foi a publicação da nova edição do Guia Alimentar para a População Brasileira, que traz um novo paradigma e novas possibilidades de uso de guias alimentares na atenção primária, né? Porque esse guia alimentar, ele entende que a alimentação é mais do que a ingestão de nutrientes, e a gente busca falar sobre comidas saudáveis que são apropriadas do ponto de vista cultural. Ele tem um enfoque qualitativo, ou seja, ele não é um instrumento de prescrição de dietas, e ele tem uma perspectiva realista e factível de levar recomendações alimentares, buscando, inclusive, apresentar estratégias que vão superar as barreiras para a alimentação saudável desses usuários. O próximo. Então, nesse sentido, assumimos o compromisso de pensar instrumentos de implementação dos guias alimentares, porque o relato que recebíamos era que os profissionais achavam muito interessante o conteúdo do guia alimentar, mas não sabia como utilizá-lo na hora do aconselhamento alimentar na atenção primária. Então, baseado nos instrumentos e nas tecnologias em saúde previstas no âmbito do Sistema Nacional de Saúde brasileiro, optamos pelo modelo, pelo formato de protocolos de uso, que são documentos normativos de alcance mais restrito, que buscam estabelecer critérios, parâmetros e padrões para a utilização de uma tecnologia específica numa determinada enfermidade ou condição de saúde. Então, nesse sentido, compreendemos o guia alimentar como uma tecnologia em saúde que precisa ser implementada. O próximo? Então, desenvolvemos os protocolos de uso do guia alimentar para a população brasileira, que ele tem um enfoque de orientar a alimentação numa consulta individual, na prática clínica. Ele utiliza um enfoque metodológico centrado nas pessoas, ele é um instrumento de apoio e de qualificação da prática clínica dos profissionais, da estratégia de saúde da família, tanto da equipe mínima, médico, enfermeiro, mas também da equipe multiprofissional, que inclui nutricionistas, psicólogos, fisioterapeutas, profissionais de educação física. Esses protocolos eles foram desenvolvidos levando em consideração as diferentes etapas do ciclo da vida. Tem uma série de protocolos que atendem a população adulta, idosos, crianças em diferentes fases do ciclo da vida, mulheres e pessoas que gestam, adolescentes. Então, levando em consideração a abordagem, o cuidado clínico nas diferentes fases do ciclo da vida. O próximo. Eu não vou ter tempo de detalhar a metodologia, mas gostaria de destacar que todo o processo de desenvolvimento do guia alimentar foi relatado nesses 2 artigos científicos e a etapa de desenvolvimento e validação seguiu uma metodologia científica baseada em validade de conteúdo e validade aparente, levando em consideração a perspectiva dos próprios usuários desses materiais, que são os profissionais de saúde da atenção primária, num processo de validação aparente do documento, dessa tecnologia. O próximo. Então, uma vez desenvolvidos os protocolos, nós fizemos um outro projeto com parceria de um hospital de referência no Brasil, que faz parte de um programa de qualificação do SUS, o PROAD-SUS, em parceria com o Ministério da Saúde, que se chamou Projeto Qualiguia, Capacitação dos Profissionais da PS. Então, uma vez tendo o guia alimentar e os protocolos, era necessário incorporar esses novos instrumentos na atenção primária em saúde. E, para tanto, a estratégia da capacitação profissional pela metodologia da educação permanente em serviço foi considerada como uma estratégia importante para implementar esses documentos. O próximo. Então, nós desenvolvemos um curso chamado Qualiguia. O nosso objetivo foi desenvolver e validar um curso de educação à distância de 30 horas para formar os profissionais de saúde para o uso do guia alimentar por meio dos protocolos. E também fizemos um processo de avaliação de impacto desse curso na alta eficácia dos profissionais da atenção primária para orientar os usuários em relação às recomendações do guia alimentar brasileiro, né? Próximo. As etapas o primeiro objetivo de desenvolvimento do curso, ele foi alcançado, ele foi comunicado nesse artigo científico, onde a gente fala de toda a metodologia e a validade de conteúdo desse curso massivo online. É importante dizer que estratégias de educação alimentar e nutricional, não necessariamente elas passam por um rigoroso processo de avaliação científica, e a gente fez questão de gerar evidência para que ela pudesse ganhar confiança dos gestores do SUS e pudesse ser implementada em maior escala. O segundo objetivo também foi alcançado, que foi avaliar o impacto dessa estratégia em 64 municípios brasileiros. O próximo. Vou falar muito rapidamente dos resultados, dizer que estudamos 74 municípios brasileiros, a taxa de adesão e finalização do curso foi excelente, 95% dos usuários. Finalizamos a formação de 1.241 profissionais da atenção primária em saúde nesses 64 municípios de pequeno porte, com uma grande diversidade de profissionais formados. Os principais profissionais foram enfermeiros, médicos, cirurgião dentista, mas também profissionais da equipe multiprofissional, fisioterapeutas, psicólogos, nutricionistas, dentre outros. Próximo. Quando avaliamos o impacto dessa formação, usando uma escala validada de percepção de autoeficácia para falar sobre alimentação, a gente observou que teve uma melhora em 58% da pontuação média desse indicador, sinalizando que os profissionais se sentiram mais confiantes para falar sobre alimentação no âmbito do cuidado clínico na atenção primária em saúde. Próximo. A gente não observou diferença em relação a categorias profissionais e a formação ela se mostrou efetiva, aumentando a percepção de autoeficácia para todos os profissionais da equipe mínima e da equipe multiprofissional na atenção primária em saúde. O próximo? Então, dado o sucesso dessa iniciativa, esse curso foi incorporado pelo Sistema Único de Saúde e passou a ser disponibilizado na plataforma aberta de educação à distância do SUS, se chama UnaSUS. Então, esse é um curso disponibilizado hoje para todos os profissionais de atenção primária em saúde no Brasil. O próximo. E a gente fica muito feliz de contar que só com um ano de implementação desse curso aberto para todos os municípios brasileiros, nós já temos quase 4.000 profissionais formados para utilizar os protocolos de uso do guia alimentar em todos os estados brasileiros, né? Então, com formação descentralizada para todo o nosso país, que é um país de dimensão continental. O próximo. Para finalizar, mencionar que essa capacitação, quando eu olho a unidade federativa, que são os municípios, em um ano nós já chegamos em 15% dos municípios brasileiros com essa estratégia de implementação do guia. Então, o próximo. Minhas considerações finais em relação a essa experiência brasileira é dizer que a gente tem demonstrado que é possível transformar a prática em saúde relacionada à atenção em alimentação e nutrição, com conhecimento, apoio e colaboração, que o desenvolvimento de tecnologias, de metodologia de aprendizagem, de integração apoiam as equipes de atenção primária e que a gente compreende que cada encontro com o usuário da atenção primária é uma oportunidade para prevenir doenças crônicas e promover alimentação saudável. Próximo. Muito obrigada pela atenção.
Obrigada, Patricia. Gracias por tu presentación. Excelente ver la manera en cómo
Thank
se
you
pueden
for your
aterrizar
presentation,
estas
Patricia, and it's excellent to see how we can land these recommendations in practice. We have several questions in the Q&A session, and at the end of the next two presentations, we will have the opportunity to discuss. Now we will go with my colleague, Leo Nethering, advisor in nutrition and physical activity in schools, so that she can share on promotion of physical activities as part of the initiative Better Care for Non-Communicable Diseases. Go ahead, Leo. Thank you very much, Leslie. I am going to share my screen.
¿Ya pueden ver?
Can you see my screen? Yes, but it is not in presentation mode yet. Now? Yes. Thank you. Okay, very well. So I will be talking about physical activity and the recommendations that we have from the WHO and how we can implement these, especially in healthcare services. It is important to mention that physical activity from birth to older ages brings multiple advantages. We have seen that there is a reduction of mortality by all causes, including cardiovascular diseases and cancer, a lower prevalence of specific site cancers, hypertension, type 2 diabetes, improvements also in mental health and cognitive health, and the educational results for physical activity, especially in the schools, and being more physically active and in older adults, they have an improvement in bone health, and in injuries due to falls are lower. In general, physical capacity improves, and physical function and quality of life improvements. There's better physical aptitude and better cardiorespiratory, muscular, and aptitude, and less fatty tissue. And it has no secondary effects for maternal health or fetal health for pregnant women. We see that it is important to promote physical activity to have a better care, medical care. In the green part, we see the medical care costs for active people, and we see that these costs at advanced ages start increasing. And for people that are active starting at the age of 40, we see a much higher cost in medical care due to inactivity. And by 60, the cost of medical care is 3 times higher for inactive people than for those who are active. And that is why the main recommendation from the WHO is that each movement counts. So with these benefits, any level of physical activity is better than being completely inactive. But we have seen that the benefits are greater without representing risks if we practice 150 to 300 physical activity at a moderate range throughout a week. And with this, it is important to define what we mean by moderate intensity. And these are basically the things that we do daily, like walking, home care tasks, playing, and sports, riding a bicycle, dancing. And when we talk about vigorous intensity, we're talking about running, swimming, competitive sports, and martial arts. Aside, we also have to have muscle strengthening activities such as weightlifting or maybe carrying heavy bags. We can talk about yoga, Pilates, or Tai Chi, abdominals, and heavy gardening. So as you can see, there is no need to go to a gym to be able to do these activities. We can include them in our daily routines. For example, carrying the heavy shopping, or taking the stairs instead of the elevator. And well, what we want to do is reduce sedentary behaviors. This is any behavior that has a very low expenditure of energy. That would be sitting, reclining, laying down, and this can include work at the office, like being at a desk or driving a car or spending too much time in front of a screen. For children, their physical activity needs are greater, and they have to spend at least 60 minutes a day all week long, and they should include aerobic activities of vigorous intensity 3 times a week, and other activities that strengthen muscles and bones. And as I mentioned, for adults, we are talking about 150 to 300 minutes of moderate intensity, or half of that if it's vigorous intensity. But the more, the better. And you should also add muscle training, muscle strengthening activities twice a week, and multi-component physical activities, especially if we are talking about functional balance and moderate intensity strength training or higher. These recommendations do not just apply to healthy adults, these also apply to older adults and even those who have chronic conditions or disabilities. These are general recommendations. They apply to the general population, and obviously we also have to consider individual capacity. It is also important to know that pregnant women have the same physical activity recommendations and can do moderate or even vigorous intensity physical activity, especially if they were already physically active before pregnancy. This will not represent risks. All of these directives for physical activity for the different age groups, and it also includes recommendations for sleep, are all available in the web pages of the WHO and PAHO. And I will mention that some data on how we are doing regarding physical activity. Recently, we published the document of the WHO, and we are not achieving the global goal of having a relative reduction of 15% of physical inactivity in adults for 2030. What I would say is we're going the other way. Only 36% of the population in the Americas is achieving those recommendations for physical activity. And this is 5% higher than the global average. It has risen by 6% in the last decade. We see that women are more physically inactive than men, 41% of women versus 30% of men. So we see some gender matters. Women face more barriers in being physically active compared to men. And with the next slide, we see that the WHO has launched a few years ago the Global Action Plan for Physical Activity that has 4 big components. One is to create active societies. Basically, here we're talking about creating social norms and attitudes that favor physical activity. This would be a change in paradigm that we need to implement because physical activity is being considered something that hurts, something that is tiring, or you'll get tired doing it. And we have created a world that makes it easier to use cars, to use elevators. Well, in reality, we should organize society in a different way, and that is why we have component 2 that is about creating environments and spaces that can be more apt for physical activity. For example, the way in which we design our cities, our roads, our neighborhoods, all of that requires a different focus to make physical activity easier. And with this, we can also look at having greener cities. The third one is the environments where we promote physical activity. We can think about schools and workplaces prisons, hospitals, and all environments can do things that promote physical activity. This includes primary care, where we have to think about, we also have to have active systems. That is, we need to have national level planning. We need to have governance to promote physical activity and incorporate it into intersectoral policies. Very well, I talked about the 4 objectives. We have policies that specify which activities can be implemented. So this action plan provides a mandate. It is important to also connect it to the Sustainable Development Goals for 2030. We have the goal to reduce physical inactivity by 15%. We also have to think that physical activity relates to 13 out of the 17 Millennium Goals for sustainable development. So it helps maintain a healthy weight. It helps to improve the health of people. It helps us in school performance. This is a way to empower girls and women. It helps us have a healthier, more productive labor force. It helps us with sustainable infrastructure. It helps reduce inequalities. It helps improve air quality by using less fossil fuels. It helps us protect the environment. And discrimination is reduced. So it relates to multiple goals, and this is important. We are focusing on these benefits because very often in health what we say is that it is good to do physical activity for your health, but in many countries people ride a bicycle not because of their health but because of the environment, maybe, or because they can get to somewhere faster. So we have to consider all of the different motivations that can exist. So we also want to provide a roadmap for member states. Now, I have talked about the benefits. The mission of this plan is to make sure that all people have access to safe environment and diverse opportunities to be physically active in their daily lives and contribute towards individual and community health and contribute to social, cultural, and economic development. We have some resources in the active package, which is evidence-based and includes some key components. And we have a series of documents. We have the guidelines that we have for the different age groups. We have a guide to promote physical activity for older adults, promoting physical activity in schools, promoting physical activity through digital media, promoting it in primary health care, and also how to promote walking and cycling. All of these tools are available in both Spanish and English on our webpage. This is the physical activity guide, physical activity through digital technologies. We are working more on this area. Using adequate mobile technologies, we can have success in increasing the levels of physical activity of the population. This guide has been specifically designed for older adults and adults and those who are also living with a chronic disease. It can be adapted to different realities. This is a guide that is particularly important for this initiative of improving primary health care. All patients of any age that goes to a healthcare service facility should receive some guidance on physical activity. This isn't just for those who are living with a non-communicable disease. So there is a focus that we call the 5 A's. The 5 A's to promote physical activity. The first one is that we must assess the current level of physical activity of the patient and see if there's any risks. We can see in which domains the patient could improve their physical activity. In this sense, we must advise the patient on how they could incorporate this sort of activity into their daily routines and how to reduce sedentary habits. We have to agree on a physical activity goal. This should be a realistic goal because if we set a goal that is very high, we will demotivate the patient and then we won't be able to achieve anything. So little by little, we can advise the patient so that little by little they can become more active. We have to assist patient with supporting strategies, and we also have to arrange follow-up visits and, if necessary, refer the patient to support services if necessary. So, healthcare services and health ministries must prepare a plan, and they can include this into primary healthcare routines. It is important for them to develop or adapt a protocol so that it can be adapted to their environment. They should also carry out pilot testing for that protocol. They should prepare a support structure so that they can scale this and prepare the necessary human resources or human talent, the labor force in those healthcare services, and apply, integrate, and do follow-up on that protocol. So basically, this is based on evidence. We must guide those who are responsible in formulating policies and also program managers, and this should be part of the routine delivery of evaluations. This is a brief intervention for physical activity, and it is considered one of the best buys, that is to say, one of the most cost-efficient interventions recommended by the WHO for physical activity. So, in reality, there's no more excuses to not promote physical activity. And with this, I would like to repeat the many benefits, and I would like to thank you for your attention. Thank you very much.
Muchas gracias, Leo. Hay muchas preguntas.
Thank you so much, Leo. There are many questions requesting for the links to the guides that we will soon share via the chat. Just to tell you, we have fortunately around 500 participants remotely, which means more people cannot join the room because we have a maximum capacity of 500 people. However, tomorrow, the recording of this webinar will be available on the virtual campus, so you can enroll. There's still time for you to enroll and to watch it offline and to go through the assessment for certification. Having said this, we will now hand the floor to our last speaker, in Carolina Baumsa, who was a reference on physical activity in the Social Security and Healthcare and Social Protection Ministry, Colombia, who will be sharing experience on promoting physical activity in primary health attention. Come in, Carolina, and welcome. Thank you so much, and good morning to all. So now I will be sharing guidance that we follow from the non-communicable disease area on healthy lifestyles to strengthen this deployment on physical activity advisory or guidance in primary attention Colombia. Let's go ahead with the first slide. So the major challenge in our attention is having all these actions that are coordinated and complementary happen. You need to click on it like 4 times. And then what's most important is for all this formulation of plans, policies, and programs to look harmoniously to the situation nationwide and also in our decentralization subnationally, since we have many actors that will provide all these strategies for promoting physical activity. As Leo was saying, because physical activity comes from promotion down to rehabilitation, and it is important for this effort to happen holistically and harmoniously. Moving on to the next slide, it is super important that under these roles, each has its own scope, as I said before. If we can continue passing the slides, guaranteeing healthcare access is a relevant activity, which is why in Colombia we have the public health care plan. Moving on to the next, the 10-year public health plan, as we see on the next slide, has some commitments. This 10-year plan has been running from 2022 up until 2031. It has many strategic pillars where which give relevance to all primary health attention issues, especially in strengthening actions that all these subnational entities have, the departments, districts, and municipalities that make up our country in order to grow all recommendations regarding physical activity. So as we see on the slide, on the right-hand side, there are some commitments so that by closing this 10-year plan, we would have been able to increase compliance to physical activity recommendations in our population, not only from the perspective of controlling non-communicable disease, but also from the perspective of health promotion. As we see, it affects not only the population that usually suffers from these non-communicable diseases, but also children from primary infancy and adolescence, so that we can achieve these goals in increasing physical activity. Let's carry on. It is super important from the view of what the Ministry of Health contemplates, that under primary healthcare attention and improving attention of physical activity, that we always promote interventions that are multi-level, not only intervening at the intra and interpersonal level via counseling to these people who arrive to the office in consultation with primary health professionals, but to facilitate conditions so that people can fulfill these physical activity recommendations, and in a more structured manner they can have also conditions and features that the physical activity should have when it turns more structured at the level of exercise, in order to fulfill these therapeutic goals for those people who have non-communicable disease. So among these and multi-level interventions, for us, it is supremely important everything that we are deploying under physical and sustainable mobility, for instance, via the promotion of active mobility, and that we've had already agreements with the Pan American Health Organization where via the tools and having established these tools and having used this instrument of the heat tool to determine that there's cost effectiveness whenever the territories increase on this issue with regards to physical activity recommendations via the area of active mobility. Another issue that is important to strengthen and to tackle this issue of promoting physical activity is intervening in regular issues of physical activity that happen in environments. In Colombia, it is supremely important what happens in the promotion of physical activity in the community area via regular programs for physical activity. And just now, there is a supremely important path, and this is all the issues of attention via basic levels of attention's extramural level. So these teams have under their leadership implementation of a program or an integrated system of care where it is super important to reach the the home domain and to strengthen capacities in the member of that household with regards to risk assessment. So it is not only about identifying risk, but strengthening capacities, and under strengthening capacities is super important promoting healthy lifestyles and centered on what happens intramurally. It is super important for us to strengthen the skills of these healthcare professionals so that they can provide brief counseling to their patients in facilities so that they can be physically more active. Moving on to the next, on the next slide, we see the skills that these subnational entities have that are denominated here in Colombia as health secretariat. So it is making visible via the promotion of healthy lifestyles and the promotion of physical activity how these interventions are performed to improve this compliance, but also to strengthen all of the component for controlling chronic disease via this strategy or intervention, which is the promotion of physical activity as a non-pharmacological intervention to achieve that control of those non-communicable diseases. Also through the mental health policy to look into all of the benefits in promoting physical activity through control and promotion of mental health in our country, and through the environmental component, everything pertaining to healthy and sustainable mobility via the promotion of active mobility. And under the healthcare systems and health service providers, the human talent, and focusing on all of this counseling on physical activity, and to especially achieve monitoring and assessing intervention of what they do. Super important for us is to overcome the processes and the stages of designing interventions and to get to establish monitoring, follow-up, and assessment mechanisms for these interventions to shed light on their cost effectiveness, especially to achieve synergies that are financial and technical that may have these programs and this counseling and this promotion to become systematic in healthcare services and to shed light on decision makers in that these are cost-effective measures so that resources can be allotted with this purpose. Moving on to the next, in Colombia, we have an agreement with the Ministry of Sports and the scientific community and universities. These guidelines for promoting physical activity and counseling, especially to strengthen these processes within healthcare services and to provide certain tools that can be employed by healthcare professionals without it mattering their specialization, whether they are nurses, psychologists, general physicians, family physicians, physical therapists, occupational therapists, so they can intervene their patients via some counseling and physical activity keys. This process is made via something, moving on to the next, which is called the route to promoting and maintaining health. And the whole issue of improving the matter of achieving via these interventions impacting the cardiovascular risks is being addressed in patients, which is important under this document to establish for healthcare professionals and to establish an intervention path so that these recommendations can become tangible in patients via facility attention. So it is important these 4 stages that you see, assessing the patient, to perform brief counseling per se, to perform promotion and recommendations for exercise, and to get to referring that patient to program services or to strengthen those environments that we want. Moving on to the next, as for assessing the physical status of patients, it is super important to question their daily physical activity that the patient is doing. So we raise awareness in professionals in healthcare so that in every attention they should question this physical activity. With regards to brief counseling, as Leo was saying, is super important for this brief counseling to be supported in these theory for changing behavior so that they can support effectively these patients. And the next, issuing recommendation on physical activity and prescription of exercise as it should be done. Moving on to the next slide. Under this promotion and recommendation, it is super important to insist to healthcare professionals for them to generate recommendation in written form that can be detailed, just like we tell and prescribe patients in written form on certain pharmacological measures that the healthcare professionals should also take their time to perform this recommendation and this prescription in written form from the patient, because many things the patient will forget when they get back home. So it should be in written. And super important, this 4th point, which is referral. So referring the user into the local offering. And this referral, we're telling the healthcare professional that they may set in a statistical system, what we call here the RIPS, which is the record of attention, that can include the code where the referral was made so that we may see statistically that the patient should know about the counseling process. And the other thing is acknowledging the local offering so that the patient can know what they can do in their environment and in their situation, whether it's easier for them to follow the recommendation in what dominion in active transport, or for them to do it at work, or for them to do it in their educational institution, but so that there can be referral to those environments, because as you can see on the slide, it is very few patients that will remain in the healthcare system performing that physical activity or that exercise, be it because they went to physical therapy services or cardiac rehabilitation services, but otherwise we will have to get busy with what happens in other environments, such as community environment, the labor environment, or the educational environment. And it is super important the achievements that we have had on this matter, what certain municipalities could have made, or certain departments locally, where they are able to measure cost effectiveness, and if there is an economic return in increasing these regular programs in their patients with non-communicable diseases. So, for instance, here there is research from the Cauca department that for every deposited weight deposited in physical activities programs, they had a return of between 1.7 and 2.2 return in pesos for every peso included in the physical activity promotion programs. And the next, another tool that was run, as I said, the heat tool, where we can see the cost effectiveness to increase everything pertaining to active mobility in our country. This was also our research of cooperation with PAHO, as I said, and we were able to see that there was a return or savings between 2.6 and $337 million yearly, depending on how much it was able to be employed, the bicycle in these municipalities that you see here in our country, and that it was avoided with the use of the bicycle between 2 and 255 deaths yearly by increasing active mobility in a safe manner in our country. So these exercises, these studies for cost effectiveness are supremely relevant so that we can perform those financial synergy and these technical resources. And now then the last slide to finish. to talk challenges that we have, harmonizing all of those public policy, territory level policies, mainly because the physical activity happens in some environments that will be or that will make other information systems, and that we need to bring to healthcare services to know these people who perform their physical activity via the community environment and their active mobility. How much impact is it bringing for us in controlling disease and promotion? And especially one significant path is knowledge management to try to strengthen the capabilities in our healthcare professionals so that systematically they can recommend physical activity in our attentions, and to strengthen all of the communication strategies, and to have communication system and implementing intersectorial pathways for what I was saying, for that this data that we have to see how it affects the health and the quality of life and the well-being of our inhabitants. The next one, this is what I had to tell you today from Colombia. Thank you very much.
Excelente, Catalina. Muchas gracias por tu
Excellent, Catalina. Thank you so much for your presentation. We only have 8 minutes for some questions. I believe we will take one for physical activity and one for healthy nutrition. We ask our panelists if you can help us by turning on their camera. Vanessa, you will have ready some of the questions for our panelists.
Estás en mute.
You're muted.
Gracias. Bueno, primero que nada quisiera agradecer a nuestras dos colegas de Brasil y
First of all,
Colombia
I
que
would like to
realmente
thank
han
our colleagues from Brazil
presentado
and
un
Colombia
sistema
who
muy
have presented
innovativo y que
a
funciona.
really innovative
De
system
esa
and which
manera
works.
ven a rescatar
I believe it's
Best Buys
worthwhile
funciona y vemos
taking
el ahorro significativo
that
que
as a
esto
conclusion. The Best Buys
representa. Tenemos
represent
acá en
savings,
la
and we see
mesa
the
cada
economic
una de las
savings that this
preguntas y
represents.
hay algunas que
I
se
was looking at some of the
repiten.
questions, and there are some repeating.
Aquí hay una de
Here there
Javier
is one
Peinado
from
Rivera
Javier
que dice
Peinado
cuáles
Rivera,
serían las
who says,
recomendaciones
what
para
would be
iniciar
the advice
terapias de
to
actividad
begin
física en adultos
physical
sedentarios que
activity
trabajan
therapy
en
for
un entorno
sedentary adults who
administrativo?
work in an
Quizás podría
administrative
leer esta pregunta
um,
poniéndome de pie para
domain?
alinearme
Perhaps
con las
I should answer this
recomendaciones
question
de
by
nuestros
standing in
tratados
order to align with the
anteriores.
guidance
Si nuestros panelistas quisieran
that we have.
comentar
If
en
our
eso.
panelists would like to
Piensen
comment about
muchos
this,
de nosotros trabajamos
what
sentados la mayor parte
as
del
most of
tiempo
us
o
work
nuestro
sitting down
trabajo
most of the
requiere que
time,
estemos
or our work
inmóviles
requires
haciendo
us to be
sin poder
immobile
hacer 10.000
without
pasos o
being
5.000
able to
pasos en un
take
día. ¿Qué propuestas
10,000 or
podrían
5,000
sugerir
steps in a
durante
day?
esto?
What proposals do you believe can be implemented here?
Bueno, tal vez yo puedo
Perhaps I
mencionar
can mention
algunas cosas.
some things.
Bueno, la terapia física
Well,
pues ya
physical
dependería,
therapy would
digamos, de la
depend
condición
on
individual
the
del
individual
paciente, pues
condition of the patient, but
sí, en general, la actividad
if
física
in
se debe
general physical
promover en
activity
todos
should
los
be
entornos
promoted
y
in
el
all
entorno laboral es
environments,
uno
and
de ellos.
the
Sí,
workplaces
pues
being
los
one of them.
escritorios que se pueden
If
subir ayudan,
desks that
también
can
pueden tener
be raised
reuniones
help,
no sentados,
they can
sino
also have meetings
parados.
sitting
También
down and not
pueden haber
standing.
mensajes
They
alusivos
There can also be
en las
messages
escaleras. Las
alluding
escaleras
to
deben
that
ser pues
in
agradables
staircases. Staircases should be
motivar a la actividad física y
uh,
estar
nice and
limpios y
motivating physical
bien
activity and being
iluminados
clean and
para
well
que
illuminated,
sea pues
so
un placer,
that it
digamos,
is a
subir
pleasure
las escaleras en
to go
lugar
up
de
the
escoger
staircase instead of
el
taking
ascensor.
the elevator.
También las compañías
Also,
pueden
companies
fomentar el
can
transporte activo
promote
a
active
sus
transport
empresas al
in
tener
their companies by having
suficiente
enough
espacio o opciones
space
para poder
or
estacionar
options to be able
una
to park a
bicicleta o
bicycle,
para
or
poder bañarse,
to
digamos,
be able to bathe,
incluso pues las
and
empresas
even
pueden dar
companies can
también
give also
como subsidios
like
económicos
economic
para promover el
subsidies
uso
to
de la
promote
bicicleta, como
the
dar un
use of
bono
the
para
bicycle,
comprar
such
una
as giving a
nueva
bonus
bicicleta
to
o
buy a new
dar,
bicycle, or
digamos, incentivos financieros
giving
para
financial
personas que
incentives
vienen
to
con
people
transporte
who
público al
come
trabajo y no
to
con
work
sus
in public transport and
carros.
not with
Entonces
their cars.
hay muchas
So there
opciones
are
y
many
como
options, and
mencioné, bueno,
As I mentioned, taking public transport automatically, like walking from home to the station and from the station to work automatically, we are more physically active than when we take or use the car.
Gracias, Leo. Quizás puedo tomar una
Thank you,
pregunta
Leo.
o
Perhaps I can
comentario
take a
con
question
relación
or
a
a
la
comment
alimentación.
regarding
Hizo otro
nutrition that
participante,
another participant made.
English, Ricky Ronaldo Therick. He says that one thing that has become of concern right now is how to control local markets and home industries, because it might be that governments can't do the quality control of local markets and that sell raw foods, packaged products, packaged drinks, and other home industries. And this is a constant challenge. And perhaps, Fabio, you'd like to comment on that. We do know that marketing and food markets are a challenge. And before Fabio, there is also another comment about, this one's Spanish, jarabe de maíz y fructosa, que son
High
ingredientes
fructose corn
comunes que
sugar,
se ven en
which
algunos
are
de los
common
alimentos
ingredients that are seen in some of the ultra-processed foods. This is a comment from Mercedes Maraví.
Over to you, Fabio.
Con usted, Fabio.
Talvez primeiro queria ouvir
Perhaps
o que
first, I wanted
Maybe
to
first of
see
all,
what Patricia,
maybe
perhaps she wants
Patricia
to
would like
comment, and then I
to
can also
make
add
an
mine.
observation, and I can add to that.
Bom, são
Maybe
excelentes
for both
perguntas.
questions. Both
Sem
are
dúvida
excellent
alguma, acho que a gente precisa
questions.
combinar ações que são
There is
ações de
no
cuidado
shadow of a
integral com ações
doubt
regulatórias, né?
that
São
we
ações de
need to
proteção à
add
saúde que, independente
regulatory
dos
measures
comportamentos
to our
individuais, vão
efforts.
proteger as pessoas
Besides
em relação ao ambiente
individual behaviors, we
ao
need to
promotor da
protect
saúde.
people
Então, medidas de
as
regulações de
regards the
publicidade, de marketing,
overarching
rotulagem nutricional,
dietary
elas são
environment, and that
essenciais na
has
agenda
to
da
do
promoção
with
da saúde. O
marketing,
Brasil
with
e a América Latina
controls.
têm
These are
vivenciado
essential
algumas
to good health.
experiências.
In
Mas,
Brazil
por
and
outro
Latin
lado,
America, we have
país que tem
seen
um
a
sistema de
few
saúde orientado pela
experiences.
visão
On the other
primária,
hand,
ele não pode
a
deixar de ter
country
o
that bases
compromisso
its
de
healthcare on
orientar e
primary care
qualificar as equipes de
cannot
saúde para que implementem as suas
help
guias
but
alimentares,
try
né?
to
Acho que são
orient
iniciativas
its healthcare
conflitantes, mas
teams
iniciativas complementares.
to
E o que a evidência científica tem
implement
mostrado é ainda uma certa
complementary
dificuldade dos
measures.
profissionais
And
de saúde
scientific
em
evidence
utilizarem
has
as guias
shown that
alimentares que
healthcare
são as diretrizes
professionals
oficiais no país sobre
have
alimentação
had
saudável.
a
Agora, um pouco essa é a
few
experiência. Ainda mais se
issues
tratando
in
de um tema como
implementing these
uma
dietary
nova
guidelines. When we
disrupção,
speak
né, na
about an
compreensão entre
issue
alimentação e saúde,
which
que é
have to
trazer o
do
conceito
with
dos alimentos
a new
processados
understanding of the
e que muitas vezes
complementarity between
ele
healthcare
é atravessado,
and
inclusive, por uma
nutrition,
incompreensão da melhor
which
evidência
is
disponível
many times
e como
surpassed
orientar a
by
população
an
em relação a
lack
isso.
of
Acho que eu passo para o
understanding
Fábio
of
complementar.
the
Obrigada.
available inputs and how to forward that to the
Yeah, so
population.
to
Thank you,
answer, just to
Patricia.
add a couple of points, Rick, because I do see that your question also addressed the issues about food safety too, in addition to other issues related to local markets or home industries. So one of the things I think it's important to make the distinctions that the issues related to, for instance, street food or other kinds of um, prepared foods. Although we have those issues, and this is something that, as Patricia was mentioning, it's something that requires close look and regulations so that this is safe for everyone. One of the things that historically has been shown is that the amount of food that people eat from those retailers is not the one that is prevailing over time. So the amount of street food that people eat is just the same or even less of what people has been eating. So they're eating much more of ultra processed products, and that is, let's say, if we're balancing the concerns, is our greatest concern. But you add a point that I forgot to mention in my intervention, that is also how we make recommendations based on where people buy their food too. So farmers markets are actually a good way of guiding people's change to a healthier purchase. Not only because you're gonna find products that are the ones that we recommend for a healthier diet, such as the fruits and vegetables, the pulses, but also because it's the opportunity for you to buy more seasonal products. These will probably be cheaper. They might be ta more tasteful, and that will help engage people to a healthier diet rather than if you were or if they were making more their purchases in places where ultra processed products are more easily found, then you're increasing their chances of not, let's say, or having more difficult to resist the marketing strategies that you can find in those large supermarket chains, for instance. So it is an important investment for governments and, of course, for societies to promote farmers markets, just because they will be bringing healthy food for the cities, but also because they will be favoring a more virtuous cycle of development for the country too. And then as for the question related to the um, corn syrups and other sorts of or fructose and other sorts of ingredients of ultra processed products. So there's much more ingredients than the syrups and the fructose that can be found in ultra processed products. But these are one as the example that was given, one to help identify those. But basically, those ingredients that one cannot find in their kitchen, those ingredients are the ones that can help us or help people identify the ultra processed products. Why regulations are not specific to those? So I guess the future of the regulations that we're working on with our member states is to have warning labels or label the ultra processed products so that anyone can find those and avoid purchasing and consumption those hopefully in the near future. Thank you.
Gracias, Fabio. Creo que Leslie, me parece que solo nos queda un par
Thank
de
you, Fabio.
minutos
I
para
believe we only
cerrar.
have a couple minutes to close.
Correcto, ya tenemos que cerrar.
Correct. We need to wrap up now.
Quisiera agradecerle a todos su
I would like to
presencia
thank
aquí hoy en
everybody
este
for their
importante
presence here today to
tema
discuss this
que
important matter,
nuevamente se enmarca dentro de la
which again is
iniciativa
framed
de
in the initiative
atención para las enfermedades crónicas o
of
enfermedades
attention
crónicas
of chronic
NCDs
disease
que está
or better
liderando
care
la
for NCDs, which
Organización
is
Panamericana
being
de
led
la
by the
Salud.
Pan American Health
Esto es a
Organization.
nivel de salud
This
primaria,
is
de
at the level
atención
of
de salud
primary
primaria. Y para que
primary
eso
care.
pueda resultar
And for
efectivo,
that
contamos con
to
el apoyo de la
work, it is
comunidad, de
fundamental
la
to have
sociedad civil,
support
de
from the
la
community and civil
academia, de la
society and academia
comunicación,
and
de las
research
organizaciones
and
gubernamentales
government
en
organizations
conjunto. Por lo
as a
tanto,
whole.
agradecemos muchísimo su
Therefore, we
presencia
thank
aquí.
you
Esos
much
son
for
los
your
temas que
presence
nos
and the
desde
examples we've
Brazil
had,
como de
both from
Colombia
Brazil and
nos
Colombia,
inspiran a continuar trabajando en esto y
inspire us
también
to
son una
continue working on
invitación
this,
para que
and are
ustedes
also an invitation
incorporen a nivel
for
primario,
you to
empecemos
include at
la
the primary
discusión,
level and
cuenten
to
con
begin
nuestro apoyo
discussion
técnico
and
para
to have our
continuar
technical support to
expandiendo las
continue expanding
posibilidades
the
de
possibilities of
implementación de actividad física a nivel de
implementing
atención
physical
primaria
activity
y
in primary
expandir aún
care
más a
and
pesar
to
de los
extend even
desafíos
further
que
in
han
spite of
sido
the
comentados
challenges
aquí
that have been
por
told here,
ambientes saludables.
healthy
No puedo
environments.
cerrar la sesión
I
sin
cannot wrap
agradecer
up
a
the
los
session
colegas
without
de la unidad de
thanking the
factores
colleagues
de
from
riesgo,
the risk factor
nutrición,
unit
Fabio da
and
Silva
nutrition,
Gómez, Leonel
Fabio da
Dervin,
Silva
Leslie
Gomez, Leonel
Samara
Dervin,
Bejar, que
Leslie
han
Samara
coordinado
Bejar,
esta
who have
actividad,
coordinated this
nuestra
activity,
colega Cintia
our
Hospital, que
colleague Cynthia
coordina Better
Hospital,
Care for
who
NCD, junto
coordinates
al doctor
Better Care for
Jonas
NCDs, and Dr.
Jonas
Jonas, who I don't know if is here,
García, que no sé si se
Jonas
encuentra
Garcia,
aquí,
who
y
I'm
por
not sure
supuesto
if
nuestros
was able
colegas
to
que
join
están
today, and of course our colleagues who are
para
translating
ustedes y
all of
nuestros
this for
colegas de
you, and
comunicación
our colleagues
Aranza
from
y Gabriel.
communication,
Muchísimas
Aranza
gracias por
and
estar disponibles
Jean.
en el
Martin, thank you so much. All of this will be available in the virtual campus of the Pan American Health Organization starting tomorrow, and we hope to see you again in a following webinar. Thank you very much.